On the day of your procedure, you will be admitted to the Jim Shahi unit. You will be greeted upon arrival by a member of staff who will show you to a bed space for the day. The heart is a muscular organ which contracts blood continually around the body. Like any other muscle, in order to work, it needs blood and oxygen, which are supplied by 3 coronary arteries that wrap around the outside of the heart. The inner walls of arteries are smooth, allowing blood to flow freely through them. Over time, fatty deposits can build up on the inside of arteries, causing narrowings or blockages that restrict blood flow to the heart, causing symptoms of chest pain and shortness of breath. Your paperwork will be completed by a nursing member of staff, which will involve recording your observations such as blood pressure and pulse. A doctor will have already discussed any alternative treatments with you. If there is anything you are unsure about, or if you have any questions, please ask the doctor before signing the consent form. Prior to entering the lab, a member of staff will confirm your identity and also complete your pre-procedure checks. In the lab, you will be asked to lie on an X-ray table. A cardiac physiologist will attach you to a set of leads on your chest, arms and legs, which will record your ECG and pulse. Your blood pressure will also be recorded. If your procedure is from your wrist, your right arm will be placed on an arm board. A nurse will clean the area of incision, which could be your wrist or groin. We tend to complete more angiograms from the artery in the wrist, to aid recovery time and convenience for the patient. However, we may use the groin if the pulse in the wrist is weak, if there is a previous history of coronary artery bypass grafts, or if you have bendy or wriggly arteries in your arm. You will be draped with a sterile sheet to reduce the risk of infection. The procedure is done under local anaesthetic around the incision site, which may sting. Following the local anaesthetic, an incision will be made into your artery. A small straw-like tube is inserted into the artery to gain access. You may feel slight pressure at this stage. If from the wrist, you will be given some medications into the tube which will relax the artery, but you may feel some burning sensations. This is a normal feeling and will last a few seconds. A catheter, a thin flexible tube, is passed through the tube in your wrist or groin into the artery and into your heart. A line is attached which will be used to inject the dye through the catheter to your arteries, which will show on the X-ray. A series of X-ray pictures will be taken using the X-ray machine, which will move all around you. Those pictures will be used to show the arteries around the heart. You may feel occasional thumps and bumps in your heart. This is normal. There is nothing to worry about. You may feel a hot, flushed feeling when the dye has been injected. Often patients don't feel anything, but if you feel any discomfort, please do inform the staff. An angiogram usually takes about 10 to 20 minutes and you will be awake throughout it. If the procedure was through your wrist, a special pressure band is applied, which is slowly released by ward staff on your return to the ward. If the catheter was inserted in your groin, a special closure device called an angioseal may be used, or you may need the tube removed by the staff on your return to the ward. You will be asked to remain lying flat for a period of time between 30 minutes and 1.5 hours. After your procedure, you will be taken back to your bed space where staff will monitor your blood pressure and pulse. We will also check the wound and circulation of blood in the limb that was used. Prior to your discharge, the doctor will explain the results of the angiogram and tell you about any further treatment if necessary. You will be given a discharge booklet which will explain what to do when you get home. Please do not hesitate to ask questions at this time.